Another episode. Today, I wanted to take on a topic that is frustrating and annoying, and I get it a lot when patients approach me when they ask for dry needling. I'm going to issue one basic statement that dry needling is acupuncture. No matter what people tell you, there is no difference. The difference is the practitioner, but the actual procedure is the same. Okay, and what that means is that, and it's not just me saying this. This is the bigwigs. This is the American Medical Association. Don't take my word for it. You can Google it. They have said that dry needling and acupuncture are the same thing. So when it's done by a physical therapist to say that they can try and do acupuncture, it's still acupuncture, but I would say if you're comparing apples to oranges, the skill level, the experience is not the same. So if you're going to do dry needling or acupuncture, you should always go to an acupuncturist. If you want to do physical medicine, you should go to a physical therapist.
Yeah, just as an addendum, just to hammer home this point, the name dry needling actually refers to the fact that there's no medication on the needle, which is the same for most acupuncture treatments. There's some very esoteric schools that will put certain herbs on the needle, but for the most part in America, if you're going to an acupuncturist, there's no medication on the needle. So essentially, they just took the name of what we're doing and they just recalled it something else, and they're making people think they're two different things, but it's the same thing. The difference is the context, meaning that if you're getting dry needling, you're getting it from a physical therapist, which means you usually have a musculoskeletal issue. For us, that's yes and, meaning we can do internal medicine, we can do sequelae to like strokes, we can do dementia, Alzheimer's, people obviously for fertility. You guys hear us talking about that all the time. But I think that if you ever get confused, just understand this very simple mnemonic, that dry needling, by and large, is strictly for musculoskeletal. Acupuncture is for musculoskeletal and internal medicine.
Yes.
Which is why it's better, because why would you need two people?
Well, so if we were going to, again, get back to the comparing apples to oranges, it's a quality thing, right? So in the state of New Jersey, somebody who's doing dry needling as a physical therapist has only been allowed to do that within the last few years. So if you take somebody like myself, I've been doing it for 20 years. So it's a quality issue. Do you want to go to the person that just got their license out of a Cracker Jack box, or do you want somebody who did 3,000 hours and has been practicing for 20 years? That's the first thing off the bat. Now, what Greg is talking about is the value now. The value of seeing an acupuncturist. You could go and take care of your back pain to a certain degree with a physical therapist who's doing dry needling, but again, do they have the 20 years to solve that issue a lot quicker? And do they have the ability to possibly handle your allergies, your digestive issues, your generalized anxiety and depression issues, your neurological issues, everything. Here, we don't differentiate. So if you're, it does matter as far as positioning, right? I can't do your knee and your back at the same time, depending on where you're facing, but I could definitely do fertility, generalized anxiety, digestive, headaches, and generalized pain in one session because we have the training around that. So the thing here is like, do I want to get a lesser value? Do I want to save money? But it's, you get what you pay for here, right? If you're paying a little extra and we're doing all this stuff and resolving all these issues, why are you just throwing your money out the window?
There's also the question of nuance, right? Because you have to consider that the doctor and I, we got into this medicine because we knew how much you can do. We know how much you can help. And the truth of the matter is, like, an outsider can come and say, oh, this is sour grapes, people worried about outside competition. But the truth of the matter is, a lot of these people don't even believe in the power of acupuncture the way that we do. All they believe is that they can fix a muscle. Mind you, not even differentiating with whether a muscle needs to be strengthened or it needs to be repaired, which is a common problem that you have with PT anyway, regardless of dry needling. Because how many of you have gone to PT and felt like you've been getting tortured and haven't felt that you're getting better? We know because we see those people after that happens.
Yeah.
Right?
So one of the other things is, clinically speaking, what are you trying to do with dry needling? So you're doing the procedure, and you're manipulating a muscle to get it to fasciculate because it's either overused, right? So if the muscle's overused, I don't know why you would want to go and overuse it as a therapy. But the procedure is to do that. Now, some people will say that dry needling done by a physical therapist is more clinical or more effective in that sense, but I would argue to say that when I do acupuncture, we are focusing on physiological mechanisms, but it's not about me doing acupuncture. These things have been recorded. There's actually evidence to say that when you're doing the procedure, it should feel like a fish biting a small hook. That's what they're referring to, the fasciculation of the muscle. Now, they didn't have machinery and stuff to diagnose and explain physiological mechanisms, but we do now, and you're hearing it from me. When we're doing this, whether it's your sciatica, your low back, your neck, your arm, you want to be seen by somebody who has the doctorate level education in acupuncture and not a doctorate level in physical therapy, okay? It's just that simple. It's the mat, right? Who did the time, who did the work, who cares enough to pursue their education. We're not saying that people don't care, but you will even hear from other physical therapists that say they don't want to do that. They are quite happy and pleased to do their own sort of physical medicine and will tell their own people to stay in their lane. When you're looking at places, I mean, we're seeing stuff evidence, we're seeing physical therapy clinics go up against really experienced acupuncture clinics. Recently, what happened with AccuWorks, we talked about people actually on Google saying that they're better than AccuWorks, right, at acupuncture. That's not a real thing. You talk about people saying that they're doing a clinical procedure better than an acupuncturist, or because it's medical, it's better. It's flat out just not. What you're looking at is that somebody now is running their business and needs a shiny new toy to differentiate themselves. It's sales and marketing. And what I'm saying to you is, like, when you're seeing people saying that they can do acupuncture better than acupuncturists, I'd run away screaming. Okay? You don't have to call us. There's other people out there. But just beware, if somebody's saying they're saying dry needling is better, or that it's different, or that they got a better handle on it, that is that's just, again, marketing and shiny new toy. You might as well buy something off of Instagram.
For those of you,
in 5 seconds.
For those of you who need like a quick mnemonic to kind of encapsulate this idea in your head, you have to think about, let's take an example of cars. You can go to a mechanic that can fix your engine, they can fix your lighting, they can fix your electrical, or you can take it to Midas Tire Center. All right? They'll only go for your tires. If your tires are bad, that's it.
And they'll rip you off and get you in, Antoinette, what's that, the long-term contract, where they end up ripping you off further?
Exactly.
Absolutely.
Yeah.
So just be careful, buyer beware. Most physical therapists will tell you to go see an acupuncturist for acupuncture. Again, so when we get into the physiological mechanisms, and this is the level of depth of the doctorate level acupuncture, is that yes, a physical therapist can do the same procedures an acupuncturist and only do maybe a back muscle, neck, whatever. But when you're talking about, and we were just talking about this earlier, when you talk about dementia, when you're talking about Alzheimer's, when you're talking about fertility, when you're talking about autonomic regulation, you have to have command of the medicine to be able to handle that. Just doing a neck and back, you're missing a bigger piece of the puzzle. And that's 5 different visits, right? You could go to, so now, all right, you're getting dry needling as a physical therapist, you're going to the GI for your nervous stomach, IBS, you're going to your OB/GYN for birth control, and then he sends you to a fertility specialist because you can't get pregnant, and then you're stressed out from going through all these visits, and you're spending time, you're spending co-pays, you're going to physical therapy 3 times a week, right? This all adds up, right? And we're not saying not to go to these doctors. What we're saying is that if you had a better trained or a more knowledgeable practitioner who has an understanding on a deeper level, then we can share these things with you and say we can treat your dementia, we can treat your multiple sclerosis, we can treat your Alzheimer's, because we understand the science and the medicine and how it works. So if you're coming in for neck pain and you have some sort of underlying autoimmune condition, whether it's MS or rheumatoid arthritis, you should be able to handle both at once. You should be able to help the patient get off and be less dependent on the medication that gives them side effects. So these are things that we ask you to explore I know it's a big topic, and you should always feel free to reach out. We will be more than glad to walk you through these things, because they are complicated, but don't fall for that sort of convenience, like, oh, we do dry needling, let me work on that. No.
Yeah, and just because something is complicated doesn't mean that you can't understand it even if you're a beginner, right? Like some of the things he's talking about in terms of depth of knowledge, most of the people, when they're comparing acupuncture and dry needling, you're really just comparing a technique, meaning that we're just taking a needle and we're inserting it very, very intentionally in a certain part of the body, which is maladaptive. However, the important thing to note is that the knowledge underneath that differentiates acupuncture and a dry needlist is what's important, because that is the understanding of the human body, right? Understand that if I put a needle here and I'm just affecting this muscle is a lot different from understanding the entire cascade of the chemical cascade, the local, the central, the regional effects. All that is what acupuncture spends those extra years teaching us, which is why when you ask us how acupuncture works, we always go back to we're using the body's own internal mechanisms in order to facilitate healing and change. It's the same adage of when you're young and you're out playing and you fall and you scrape yourself, your body already starts healing because you have a scab. How does the body know to do that? We go through the extra schooling to study that mechanism and understand where in the different body can affect different parts. A dry needler, by and large, is generally only going to...
Stop calling them dry needlers and dry needlists. They're physical therapists trying to do acupuncture.
Sure.
That's the punchline here.
Whoever-
We can overstate it and we can polish it, but people are trying to move into a territory because I guess they want to charge extra on the bill, or they're trying to make their practices relevant, or they're scrambling. There's trainers, there's physical trainers that don't even have a level of the physical therapists that are allowed to do dry needling on athletes. If I had a sports team and I'm blowing millions of dollars, aka Jason Tatum with the torn Achilles, I wouldn't want some clown with a bunch of needles running around poking my athletes. I would want somebody who knows what they're doing.
Yeah.
And the other thing too is not only that, and we talk about this all the time, is that it's not going to be complicated or difficult if that person is able to explain to you and help you internalize the process, right? You need to understand from every step, from in the insertion, what happens, right? We always explain that, like, it's a very simple analogy. When you cut yourself, the body has the ability to heal itself. So why not hijack that mechanism for a lower back or a uterus or an ovary? Regionally, it blocks the pain signal in the nerve pathway, reaches the brain and releases endorphins, which further relieve pain, but also helps with that generalized anxiety. And then on the genomic level, when you're talking about these serious diseases like Alzheimer's, when you're talking about things like dementia, when you're talking about the degeneration of neurological tissue, you want to talk about releasing neurotrophic growth factors genomically by manipulating the body to do that even further. But if you just want to go and do jumping jacks on a yoga ball, then you should go do physical therapy and get dry needle.
And another point of nuance, and this isn't to shade at anybody specifically, but I can say from my experience, like I work at another place for physical therapists, and he specifically says, like, yes, I could do it, I'm certified, but I have acupuncturists to do that, so I can actually focus on physical therapy. And that's one thing I have noticed, that because there are, and Doc will admit, there are a lot of fantastic cutting-edge physical therapists.
Yeah.
One commonality that I've actually noticed is a lot of them, they got the certification for dry needling, but at one point realized that it was not only more cost effective, it was better for their patients to give them to acupuncturists, to give those patients to acupuncturists. Because if you think about it, the people at home, just think about it. Does it make sense, right? The people getting paid millions of dollars only know about generally the muscle system and the tendons, which, by the way, that's a lifetime study in itself. But you guys who've been watching regularly, Dr. Bays and I are talking about that, but we're also talking about genomic mechanisms. We're also talking about your cycle. I mean, we haven't even gotten to the fact that men have a cycle that's 24 hours as opposed to women's 28-day cycle. Our point is that a lot of you are making your treatment choices based on where your insurance is telling you to go. That, oh, I have physical therapy, that's covered, let me do dry needling because it's essentially the same. And we're saying is while you're free to do that, it is not a wise decision, because quite frankly, you're putting your care in people who have, by design, sought a loop to be able to treat you with acupuncture without going through nearly as much training. Our training is approximately, I think, like between 3,400 hours and I think 300 clinic hours. These people go and get it in a 120-hour weekend course, if that. And I'm just saying that, like, for your benefit, forget if I was even an acupuncturist. Like, would you feel comfortable letting somebody put a needle with you who only had a weekend course, when there are other people who would trade several years with several years of clinical internship, specifically designed those extra years to prevent us from hurting you, whether nerve damage or lung damage. So we're just trying to say, it's like, if you just put it on paper, it's a no-brainer.
Look, people are gonna do what's best for them, and yeah, we know you wanna save a buck, and we get that, right? But here's the thing, I've actually consulted on many cases, expert witness for collapsed lung, okay? So if you're talking about a neck or a shoulder or something like that, that's in proximity of your lungs, right? And I've had people call for specific reasons. Did this person collapse a lung? 100% they did, because they don't know what they're doing. So 100 hours, a weekend course, whatever you want to call it, is not 3,000 hours plus 20 years of experience, right? So I'm not going to pretend to say that physical therapy is, I'm going to pretend to understand it, right? I'm going to let somebody who knows what they're doing do that,
Yeah.
right? But we're here to tell you that when you're doing something like this, you should be informed about it. And that you can, when you're stumbling around in the dark because you just got your certificate and you're trying to treat somebody's neck and it's not effective, you'll waste that money in copays. You'll waste that money in time sitting in the waiting room to be seen. You'll waste that time doing sit-ups on a yoga ball because the physical therapist is working and you're working with an assistant or something like that. So the bottom line is like you could look at the numbers and you can look at that, but you get what you pay for. It is a quality issue. It is a concern. So think about that.
And the thing is, when you're trying to save with money, you're going to pay for it with time.
Yeah.
Because at the end of the day, you have to think of, we're a one-stop shop. We know we have more than like passing level familiarity with a lot of medical situations. And so all the time that you would spend going to different doctors, your GP, getting referrals, getting the testing, before you even get like a diagnosis, not even like an actual answer, we could have already gotten the ball rolling, pointed you in direction to more competent therapists, and really help you. Because I think one thing that is undeniable is like physical therapy is great, and there are some magnificent physical therapists out there, like Core in Nutley. However, I have to say that one thing that acupuncturists do is that we actually help steer our patients to understand their health better on their own, not just coming to us. Because how many of you like really stop to think that, like, ask a dry needler to help get you pregnant if you're trying to conceive with their dry needling? If they get any look, it's because they asked an acupuncturist or they've looked in acupuncture books. There's a certain level of knowledge that we have, that we're able to do with the needles, that quite frankly was what we got into medicine for, that is going to be lost forever if the dry needlers are able to convince you that it's the same thing. They're not. Like, how many dry needlers are able to tell you about the miraculous benefits in preventing Alzheimer's, preventing dementia? There are even clinics in China in which they do acupuncture clinics strictly for intelligence, like 30-minute sessions on the head. By the way, be in town if you want that treatment, we can give it to you too, if you want to study for something. But the point is, it's not just the fact that we can do this and we want to be able to do it for you. We want you to be educated to know that this is possible, and that if dry needling is your first experience with these things and they're telling you that they're not possible, you're going to be robbing yourself off with time, with money, with unnecessary suffering, when you have people right here who can help you. But other people who want to do less work, want to put in less effort, are trying to tell you we can't do that.
Greg made a point that he does work in a physical therapy clinic, and the thing with physical therapy is physical, right? So what the problem with that, not that there's anything wrong with that, but for certain situations in today's society, maybe you don't need something physical. Maybe you need 20 minutes to yourself to shut your brain off. And maybe you don't want to be sitting at a table with all the people. So the other thing too, okay, this is very important, and I think this is going to put a nice bow on the difference here. Most acupuncture clinics than the physical. Yeah, you got a knee problem, that's fine. We can treat your knee problem. We'll do it whether we're standing, doing on a treatment table, sharing the space with other people, or you could do it in a treatment room by yourself. But when we talk about the central, regional, and the local effects of acupuncture, the central part, right, the stuff in the brain, well, you have to understand something simple like a knee pain. There is a memory of that in your brain stored. that you know. So when you feel better and you're kind of nervous about going to take the dishes out, it's because you already injured your back and you know what it feels like and you don't want to go for that. Some people say, I don't have pain, but I feel like it's going to go any minute, right? That is a very cerebral part of the medicine. Now, that needs to be addressed in an environment where it is quiet, right? Where you need the endorphin release to put you in a parasympathetic state. In that state, the body can regulate that memory or that perception because that injury or that trauma or that pain that you're feeling is stored in the brain. And in that quiet state in 20 minutes without people doing, push-ups on a yoga ball or somebody yelling, screaming, and, Fox News blaring in the waiting room, that portion of quiet we have here. We share that with you because it is essential. So when I tell you to shut your phones off, it's not because, I want to remove you from social media. It's because there is a component in the central mechanism where in that state of quiet, right, without being harassed or badgered or annoyed by external stimulus, your body can regulate that perception of pain. And that is a complete healing, right, as opposed to sharing space and, smells and noises and bells and whistles. I feel that is an essential component, and I think that is what separates an acupuncturist, not from a dry needler, but a physical therapist who's trying to pretend to do acupuncture.
So long story short, acupuncture has a lot of information. It's very exciting, and it's actually very helpful. Even if you don't do acupuncture, like knowing some of the lifestyle tips can really make a change in your lives as patients, as people walking around the world, and we just want to be able to share that with you without the message getting hijacked.
Yeah.
So if there's one thing that you can take from this podcast today is that acupuncture works to give you more power, so you can make more decisions, so you can work better in your life, rather than being shackled to going somewhere at a regular time every week, even when you're not seeing results. And
Yeah.
we just want to invite you to learn about how acupuncture can save you time, money, and improve your quality of life down the line if you stick with it.
I make this distinction amongst Star Wars culture. You have Star Wars fans, and you have Star Wars nerds. I am a Star Wars nerd. I know. I play all the tabletop games. I know the velocity of an X-wing and an A-wing and all these things, and I immerse myself in the culture. The question is, do you want to see an acupuncture fan, or do you want to see an acupuncture nerd? At this point in my career, where I reached, I would say I'm an acupuncture nerd. Okay, nobody needed to explore the genomic mechanism of acupuncture. I just did it because I love the stuff. So when you're making these decisions, whether you're buying something, a Harry Potter one from Instagram, or you're picking an acupuncturist off of, what the algorithm pushes you, dig a little bit deeper and do some research. But at the end, you should always ask questions, and you should always feel comfortable. There is no detail of your health that is unimportant. So everything is relevant, and we strive to create that environment, and you should actually want that. So if you're thinking about going in network and saving a couple bucks, or really going in deep and doing the work, that's where we are.
You want to be a Jedi, or you want to be a Sith?
You can be either one, but you're definitely on the Jedi level here for sure.
Always.
And we'll see you next week.
How's that for enthusiasm?